Welcome back. Heart disease is the #1 killer of men and women, and it often builds for years without any warning signs. But doctors say you can get an idea of your risk with a few simple numbers that are easily checked. In honor of Heart Month, our Doc McGee is breaking down those numbers that we need to know and what they can reveal about our health.
I'm joined by Dr. Syed Ahsan, a vascular medicine specialist here at Henry Ford, to talk about knowing your numbers. So, Dr. Ahsan, thank you for doing this. Let's start with high blood pressure. Talk about high blood pressure. What is it to begin with?
Well, the arteries are used to maintaining a small amount of pressure that helps blood get to where it needs to be, from the heart to the organs. Over time, the arteries can stiffen and various other things can happen, and the blood pressure steadily starts to rise. And you don't know it, the arteries do, and it is also known as the silent killer because of that, because it insidiously affects all vessels across the body, and the end organs such as kidneys, eyes, brain, heart, they take the most hit of this continuously rising tide of pressure against them, resulting in damage at the end organs. So with blood pressure, the biggest challenge is you don't know you have it, the organs do, and they feel it, and when they become symptomatic, the time for intervention and making things better is long gone.
Yeah, too late.
Too late.
And so, relative to that, when should people start monitoring their blood pressure, and what should they be looking out for?
Well, in general, I don't expect the population to get nervous about blood pressure just because it's a prevalent disease, but at least have it checked once a year when your primary care doctor sees you. Have a doctor visit. If you're visiting somebody else's clinic, in a dental clinic, if you have a high number, don't ignore it. Follow it up within a week, 2 weeks, a month later to make sure it gets checked. And if you're persistently high, and when I say high, I mean more than 130 over 80, then at that point, you need to get your doctor involved, speak to your primary care doctor and say, I have been checked multiple times, my blood pressure is always high, and at this point, I'm concerned about it, because we should be concerned about it at that point. And uncontrolled blood pressure leads to problems. We talked about that. So at that point, the doctors can start advising you, maybe we're eating the wrong things. Maybe the weight is a little bit high. Maybe you're a little bit more inactive. When we exercise, blood vessels dilate. When they dilate, blood pressure comes down. When we eat right, low salt, low sugar, low fat, then at that point, the body's not under stress because you're not putting excessive chemicals in there, making the blood pressure go high. And when all that has been exhausted and you are the beautiful, perfect patient, and the blood pressure is still high, you bring in medications. And if it's still high, you bring in experts. And they help you with diagnosing why the blood pressure is so recalcitrant, it's not going back down. And now we have procedures to help at the end to bring the blood pressure down as good as a pill, like renal denervation. So we have this escalating stepwise approach to blood pressure, but the ultimate goal is control, control, control.
And there is no one-size-fits-all approach to blood pressure. I mean, it basically starts with simple lifestyle modifications, but if we need medications, even within that framework, there are different medications for different people in different circumstances. Talk a little bit about that.
Absolutely. So, you know, the first few medications that came across for blood pressure was back in the 1950s, right? We had the diuretics that came through. And
water pills.
Water pills, right? Water pills. And then over the following 6 decades, or I should say 7 decades, we are seeing medications come through. We have diuretics, the water pills. We have ACE inhibitors, ARBs, that work on a certain axis. We have beta blockers that kind of slow the heart rate down, dilate the vessel. We have calcium channel blockers that dilate vessels, slow the heart rate down. We have centrally acting ones, which kind of control the pressure from the nervous standpoint. And now we are seeing drugs that are coming out working at different aspects and different pathways. The eventual goal of all these pills is to bring the blood pressure down. The challenge is the patients and the doctors don't know which size, which key will fit the hole here. So you need to try different medications before you find the right combination. And I highly, highly recommend the patients to be very patient with their doctors, because there is no book that nobody can read or find out that this is the combination that's going to work for patient A and B. It is trial and error. And when there's trial and error, you have to just wait for the success point to come through. And it does if you persevere with the same doc.
Yeah, there's a lot of fine tuning and adjustment, and I think also tolerance of side effects because blood pressure medications do have all kinds of various side effects depending on the person. Do you find that there are specific conditions where specific combinations tend to work better? For example, someone with diabetes, or for example, someone that is particularly overweight.
So that's a great question. Certain drugs are great for certain patients, like high blood pressure and diabetes, ACE inhibitors, ARBs, great choices. Somebody who has heart disease and blood pressure, beta blockers, good choice. Somebody who has atrial fibrillation and has high blood pressure, calcium channel blockers, a good choice. Diuretics usually works across the board for a lot of patients. And those water pills are not truly water pills. We call them water pills, yes. Sure. It makes it easy for people to understand. But in essence, all water pills that we use for blood pressure decreases not only the fluid volume, but also dilate the blood vessels at some point, reducing the pressure. So it's a systemic effect that comes across the board. So highly recommend when somebody starts a new medication, watch for side effects and see if the side effects goes away, because a lot of time it does. It doesn't stick around. But if you have certain side effects, such as from ACE inhibitors, we know it can cause tongue swelling, facial swelling. Those are life-threatening side effects. Please stop, go to the ER, seek help, and please don't use it again. But then there are other medications that can be utilized in the same process, which are not ACE inhibitors and work similarly or even sometimes better.
Excellent. Dr. Syed Ahsan, thank you so much for talking to us about high blood pressure.
Thank you.